Millions of people in North America, Canada, the United States, suffer from chronic pain. And in many cases, it's totally debilitating. And many patients have had the opportunity to work with their family physician or with a pain management specialist to come up with a pain medication regimen which helps them survive, gives them some quality of life, lets them move around and do things and get on with their lives a bit. And now, most recently, because of the opioid crisis, chronic pain patients have found themselves in far too many cases being arbitrarily tapered from their opioid medications, which have been working great for them for a long period of time, because doctors are afraid of regulators and governments. Doctors have told me that. And so these patients, or they're stopped entirely, and they go through hell. And unfortunately, it sometimes results in suicide. I want you to listen to just, many of you will remember this conversation, or this caller. Just listen to a few seconds from a program on chronic pain that we aired.
I can't walk. I'm essentially useless. I'm unable to ambulate. If I'm able to get around it, I have to drag my lower body around the house because my spine is that painful. It won't hold my legs up. And I just sit around and cry. I mean, I am not able to be useful to anybody, at least of all my children.
You think about that. That is chronic pain. Now, Dr. Trudeau said he thought it's just a mild annoyance that people have to live with, said Dr. Trudeau. Barry Ulmer is the executive director of the Chronic Pain Association of Canada, and they have just finished, actually, they're going to release in detail tomorrow, a survey of Canadian pain patients, Canadian pain information. Barry does incredible work on behalf of pain patients in this country. Barry, thanks for taking the time.
Well, thanks for having me on, Roy.
I don't know how much I can talk about the survey because you're releasing it tomorrow. So let me just ask you some questions here. What was the reason for the survey of Canadians in pain at this particular time? We know things are not great for pain patients. We hear the personal experience. We just heard that of forced tapering or withdrawal of medication. So what was the reason for the survey right now?
Well, it's mainly because of that, because things have been getting worse and worse and worse for these patients, and we continually get calls and emails on a regular basis. So we decided we had to find out and verify some of this stuff. So that's why we went forward with this survey.
And we know politicians and health regulators don't focus on chronic pain patients and leave a cohort of millions in North America out of the essential conversation about the opioid epidemic. If there's an opioid epidemic, the chronic pain patients make up a significant part of it.
Well, first of all, there is no opioid epidemic. There's a problem with illegal drugs and that type of thing. But as far as an opioid epidemic, that's been overrated. And we know from studies and surveys that almost all chronic pain patients don't become addicted to drugs. There's all kinds of evidence out there, but nobody seems to want to listen to it. They keep going on to the fact that how bad these medications are, how evil they are. However, there's no evidence showing that for chronic pain patients. They just simply work and relieve their pain.
And they've been around, many of them been around for hundreds of years, like morphine.
No doubt about it.
Can you share with us a couple of the, again, I don't want to get into it because I don't know what I can say and what I can't say, Barry, because you're releasing it tomorrow, but can you share with us some of the key questions and responses?
Sure. Like the survey contacted around 740 Canadians, and out of that, 95% of those indicated that they have not found a more effective treatment for their pain than the use of opioids. Even what everybody's telling them to do is alternative medicine, but there's no evidence that helps. And then, of course, we're finding that out more and more and more. So it's a real problem.
May I just quote a couple?
Sure.
Okay. So in the past 2 years, have you been dropped by your doctor or had your doctor refuse to prescribe? 33.5% said yes. That's horrific.
It is. It's simply awful.
Have you been forced to reduce against your will? 47.8% said yes. That's almost half of the patient population saying yes. And here's one. I won't go much further here because, releasing it tomorrow. But do over-the-counter or other non-opioids help your pain? No, 83.1% of patients say that. And they're not saying it because they're addicted. They're saying it because the opioid medications help, which is what I tried to point out to Jane Philpott when she was the federal health minister and decided she was going to set me straight on opioids. And by the way, you can still find that at roygreenshow.com, and you can see how well Dr. Philpott did in setting me straight. But those numbers are frightening, Barry. They're frightening. And what do those numbers mean to the pain patient who's listening right now and saying, that's me?
Well, it means they're just going to continue to go downhill. I mean, one other point in the survey was that over 66% of them reported a decline in their quality of life. They have more pain. Yet we find Health Canada and others still doubling down on this whole thing, and they're pushing this deprescribing aspect at great expense to taxpayers. In fact, you've probably seen the Canadian Institute for Health Information just issued a report on deprescribing and are pushing this more and more, and it doesn't do a thing. We know that what they're using in the deprescribing is actually causing more overdose deaths than the opioids. It's frightening, and we just continuing doubling down on it. And in the meantime, there's these millions of Canadians who certainly have no quality of life, and it just gets worse. I mean, 66% reporting a decline in their quality of life. I mean, my God, this is the 21st century. We live in Canada, for Christ's sake.
And this is healthcare.
Yeah.
You know, I've invited repeatedly, I'm located in Ontario, so I've invited the Ontario College of Physicians and Surgeons, or the College of Physicians and Surgeons of Ontario, to participate on a program about this. And initially they offered their president, and then they very quietly withdrew the offer. And each time I ask them to come on or do something, talk to us about it, they find a reason not to do it. And that is because I know they can't answer the questions that I'll ask them, because I put you on as well. Because we're talking about people's ability to live their lives, and in something less than what we heard from Rachel.
Yeah, it's right. It's just some days it's hard listening to people on the telephone. It just and they keep coming up with references that have no meaning. They keep using research studies put out by a few prominent Canadians who we know well who've been debunked from the beginning. Yet we keep using those figures and numbers out there, and they're nonsensical. But in the meantime, these people are just suicide is a reality.
Yeah, it is. What's the prognosis for chronic pain patients if this current trend continues?
Well, it's just going to grow worse and worse and worse because, as I said a minute ago, they just keep doubling down on it and are pushing this deprescribing aspect of things. And again, the medications they're using for taking people off of what's been working for them for years is causing more overdose deaths than hydrocodone. There was just a recent study done that deaths from hydrocodone in a different jurisdiction was 1% of the total, yet the deaths from the use of the medication they're using to take people off is 3%. I mean, as I say, there's just no rhyme or reason to it. So things just get worse. They just simply cannot admit what the real problem is and what has been working.
And they've already been accused of violating human rights. So maybe, there's more to come. May I just quote a couple more?
Sure.
All right. So this is chronic pain patients answering the survey from the Chronic Pain Association of Canada. Have you experienced more pain in the past 2 years? 72%? Yes. More disability and can do less? Yes. 70.6%. Quality of life declined. As Barry said, 69.2% have had their quality of life decline. Have you found effective treatments other than opioids? 94.6% said no. Don't really need opioids? 97.8% said, I need them, and it's not because of addiction. It's because they return some quality of life. As I said to Jane Philpott, you know what they're addicted to? Pain patients are addicted to? Living without pain.
Yeah, right on.
It's not rocket science.
No, it isn't.
So this is released tomorrow from the Chronic Pain Association of Canada, and it needs to be talked about. It deserves to be talked about. This is a significant percentage of our population. The reason I get worked up is because, and I've seen the emails from listeners as well who've come out of surgeries and haven't been given opioids because their doctors are afraid they're going to become addicted. And when my wife was dying of cancer and was living through a hellacious reality, they gave her a medication, opioid, like I don't know what it was, half a milligram or 1 milligram. Like that wouldn't even help a dachshund.
That's criminal, Roy.
So, well, I rectified the situation, but I had to make a lot of noise to get it done. Yeah, and there are cancer patients who've written to me, and they're not prescribed what they need coming out of surgery. So, good luck, Barry. This is an issue that affects far too many Canadians, and it needs to get more light shone on it.
Yeah, it certainly does, Roy, and thank you for that, and hopefully somebody else will start listening, but it's frightening.
What's your website?
www.chronicpaincanada.com.
Okay, go to chronicpaincanada.com. Have a look yourself, and if you're a chronic pain patient or know somebody who is, then you know what the story is. Barry, thank you. We'll talk again.
Thanks, Roy. Take care.
Bye-bye.
Bye.
Barry Ulmer, Executive Director of the Chronic Pain Association of Canada.
If you want to hear more, subscribe to The Roy Green Show on Apple Podcasts, Google Podcasts, Spotify, Stitcher, or wherever you find your favorites. And if you like what you hear, leave us a review and tell a friend. I'm Roy Green. Have a great weekend.